Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is leukocytosis. Leukocytosis means you have a high white blood cell count. This means you have more white blood cells than normal. And leukocytosis is a normal immune response and it is not always a cause for concern. Most of the time it means that your body is fighting off infection or any inflammation. However, there are some times when a high white blood cell count could indicate something more serious, such as leukemia. Now, types of leukocytosis. There are five types of white blood cells, leukocytes. So, there are five types of leukocytosis depending on which type of cell is affected. Now, neutrophil leukocytosis. It is caused by high number of neutrophils, the most plentiful type of white blood cell, which helps resolve infection and heal damaged tissues. So first one is neutrophilia leukocytosis. It is caused by a high number of neutrophils, the most plentiful type of white blood cell, which helps to resolve infection and heal damaged tissues. Second one, lymphocytosis, refers to high levels of lymphocytes, white blood cell that protect the lymphatic system. Then monocytosis, it is caused by a high number of monocytes, white blood cells that boost your immune responses. Then eosinophilia refers to high level of eosinophils, white blood cells that play a role in fighting infection and inflammation. Eosinophilia is common and is often related to allergies, parasitic infection, and autoimmune disorders. Then basophilia, the rarest form of leukocytosis, it is characterized by an increased number of basophils, white blood cells that play a role in fighting parasitic infection, preventing blood clotting, and responding to allergic reaction. So first one is neutrophilia, leukocytosis. Second one lymphocytosis. Third one monocytosis. Fourth one eosinophilia. Fifth one basophilia. Now, what does a high white blood cell count mean? White blood cells are an important necessary part of your immune system. It is produced in the bone marrow. They defend your body against infection and disease. But when there are too many white blood cells, it is usually means that you have any infection or inflammation in your body. Less commonly, a high white blood cell count could indicate certain blood cancers or bone marrow disorders. Then, what is considered a high blood cell count? Typically, if there are more than 11,000 white blood cells in a microliter of your blood, it is considered as leukocytosis. High blood cell count during pregnancy. A high blood cell count during pregnancy is normal. Your body is simply experiencing the stress of carrying a baby. Your healthcare provider will run routine blood tests throughout your pregnancy to make sure nothing out of the ordinary is going on. Is leukocytosis a blood cancer? No, leukocytosis refers to a high blood cell count, which can occur for a number of reasons. Rarely, a high white blood cell count can be a symptom of certain blood cancers such as acute myeloid leukemia, chronic myelogenous leukemia, and chronic lymphocytic leukemia. Then, symptoms and causes. What are the signs and symptoms of leukocytosis? Many leukocytosis symptoms could indicate the infection or something more serious, such as lymphoma or leukemia. Common warning signs include fever, fatigue, pain, difficulty breathing, wheezing, night sweats, unexpected weight loss, rash, etc. Easy bruising may indicate thrombocytopenia, low platelet count, or severe acute leukemia. In cases of severe acute leukemia, extremely elevated white blood cells can thicken your body, blood, and decreased blood flow. As a result, hyperviscosity syndrome can develop. This condition can cause serious health problems such as stroke, internal bleeding, or vision impairment. Then, what causes leukocytosis? Leukocytosis is most commonly caused by infection or inflammation. Other high white blood cell count causes may include excessive physical or emotional stress, such as fever, injury, or surgery, burns, immune system disorders such as lupus and rheumatoid arthritis, thyroid problems, dental caries or cavities. Then certain medicines including lithium, corticosteroids, and beta agonists. Then allergies and splenectomy, removal of your spleen, smoking, obesity, Less commonly, leukocytosis is associated with leukemia, lymphoma, bone marrow disorders such as polycythemia vera and myofibrosis. So what are the common causes? The leukocytosis is most commonly caused by infection or inflammation. Other high white blood cell count may cause include emotional stress, excessive physical or emotional stress, burns, immune system disorders, lupus and rheumatoid arthritis, thyroid problem, dental cavities, certain medicines including lithium, corticosteroids and beta agonists, then allergies, splenectomy, smoking, obesity, and less commonly leukemia, lymphoma, and polycythemia vera or myofibrosis. Then diagnosis and tests. How leukocytosis is diagnosed? Your physician or healthcare provider will perform an exam and ask about your symptoms and medical history. They will also order a complete blood cell count. This common blood test checks for RBC, WBC, and platelet in your blood. CBC can tell you healthcare provider if you have certain condition or infection. In some cases, you might need a bone marrow test to confirm your diagnosis. Management and treatment. How leukocytosis is treated. Treatment for leukocytosis varies depending upon what caused the condition in the first place. For example, if you have high white blood cell count due to bacterial infection, then your healthcare provider will prescribe antibiotics. If leukocytosis is associated with allergic reaction, then you will probably need antihistamines. Other common high blood cell counts treatment include medication to reduce stress or anxiety, anti-inflammatory medicines, inhalers to treatment asthma, IV fluids to improve blood flow, leukapheresis, a procedure to quickly reduce the number of WBC in your blood, cancer treatments such as chemotherapy, radiation therapy, or stem cell transplant. In some cases, your WBC count may return to normal without any intervention. How long does it take to recover from leukocytosis treatment? It depends on which type of treatment you are receiving. In most instances, you can recover from leukocytosis in 2 or 4 weeks. If you are undergoing cancer treatment, it could be take longer. So thank you so much for watching the entire video. Do like, share, and subscribe to my channel for supporting me and my channel. And if you have any query or doubt, please comment down in the comment section. I will try to resolve your problems. And thank you so much for watching my videos.